ADHD is one of the most common neurodevelopment disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulses, having behavior problems, and there are other signs and symptoms. They daydream a lot, they forget or lose things, they squirm or fidget, talk too much, make careless mistakes, or take unnecessary risks, have a hard time resisting temptation, have trouble taking turns, have difficulty getting along with others. It's normal for children to have problems like this, but with children with ADHD, the problems just never go away. They continue into adulthood. The cause of ADHD is still unknown. Many people think that it is hereditary. ADHD can be treated with medication and seeing doctors and therapists. It is also recommended to have healthy eating habits, lots of physical activity. ADHD and gifted children have a harder time dealing with emotions, shown to have difficulties, immaturity, emotional struggles, and coping with large gap between their delayed emotional development and their advanced cognitive development. They have trouble relating to peers and use improper social behaviors with peers. Some positive aspects of children with ADHD that are gifted is that they are naturally curious and motivated, ask a lot of questions, have a great memory, retain information. They master reading skills early. They are independent thinkers, unique, have original opinion, higher level thinking, and strong sense of justice. Some negative aspects are easily off task, impatient, they get bored, dislike repetitive work, they take on too much, they don't work well with groups, and they're very critical of themselves. Professional development for teachers can help the teachers identify a gifted student who has ADHD in their classroom. Gifted children with ADHD have a lot of social problems. They have problems relating to others, to children, improper behavior to relate to peers, can't focus on tasks, and sometimes related to boredom, the curriculum in the classroom, learning style, or environmental factors. Some teaching tips to help ADHD gifted children are written intervention with oral instruction, clear, concise instruction, repeat the instructions to them, use timers with transitions, make sure they are listening before you speak, clear rules and clear consequences. Gifted ADHD children are at a very high risk for being misdiagnosed and teachers not seeing their giftedness in class because of the behaviors. Some accommodations that can be used for the gifted ADHD child are programs that stimulate, support, and build strengths. It's very discouraging for them. They become very messy and have difficulty focusing on tasks. Social relationships need help. They need study skills and social skills. They need challenging curriculum. There are presumptions that many ADHD students are gifted. Our staff need more professional development to help to find the gifted child that has ADHD. Also, reward programs and have them sitting near a teacher and away from distractions is very helpful. Nonverbal cues for students for attention, routines, daily checklist agendas, visual postings, and set up timers and check in with them often and with the parent. We need the parent relationship with the ADHD child. A lot of ADHD gifted students do not want to ask for help. The biggest problem with the gifted ADHD student is that they may not live up to their potential because of misdiagnosis and teachers not recognizing that the child is gifted because the behaviors are standing out and are so strong. The ADHD gifted student needs help staying organized and finding ways to deal with stress. Physical activity can be a very positive thing for the gifted student.